this in perspective for our families when we're talking about the facilities you have at Soto Christian Hospital, and we're talking about a nation that comes in dead last in terms of health care in the world, and we're talking about a nation that has how many thousand doctors to how many million people?
Yeah, it's very unbalanced.
Yeah. Dr. Kelamu is the one surgeon in an area for how many million people?
2 million.
2 million?
Mm-hmm.
He's the only surgeon.
Yes.
When we ask families to look at their second medical reports with an international adoption specialist, and the doctor comes out with this long list of questions, what is realistic for them to know and to ask, instead of us bombarding you with these questions at the orphanage level about children's medical histories?
Okay. Because I am not medical, but compassionate about it and understand the importance of it, we attach ourselves to missionaries that come in with not training but understanding of tropical disease and tropical medicine, which is limited because you cannot, in Ethiopia, you cannot come in with that kind of knowledge and understanding within a year or even 10 years. There have been surgeons and doctors that have been mission doctors for 30 and 50 years, and they say to us, you will never understand tropical medicine. It is a complicated situation. Not to scare anyone, but the reality of that is that people come in there, they have tropical disease as a result of the lack of hygiene, the lack of understanding that their bodies are sick, because they get used to their condition and they believe this is normal. If they are alive, they are surviving. When someone dies there, in certain groups of the community, the family sees it as a relief. So the mourning is in a very different way. That's the sadness of it. To expect of U.S. families to expect us to have a medical testing setup is unrealistic. There isn't. We can test basic things, HIV, hepatitis, STDs. We can test those and treat it very successfully, except for the hepatitis and the HIV. STDs are easy to treat. That they have conquered, and the children that are treated with it test negative after 3 weeks. It's wonderful. That is simple. The other complicated diseases definitely needs professional understanding and professional testing. And we know that sometimes a child would come here and a family would say, why didn't you test for this? Like heart disease. That is a specialized test that will have to go into others of a 5-day commitment of one nanny being taken out of the orphanage, affecting the 30 or the 50 children that are in there. That is the reality for us. We love to take care of children with special needs like a heart disease or like a brain tumor. And we have another system that we are working with a Cure hospital in Addis about that. And we get and there's another hospital that just opened in Awasa to do MRIs and have a brain scanner. These are not typical. This is this is very unusual for Ethiopians. If they can just be seen by a doctor and get a tablet for pain, that doctor becomes their medical hero. They don't have a pharmacy they can go to. They don't even have a pharmacy kit emergency kit in their homes. That is far beyond reach. Medication is expensive for them. Antibiotics are expensive. It's a luxury for them.
And there is no insurance.
There's no health system. There's no health insurance at all. No. And healthcare has become, or has always been, on a very, very low, a priority. It's not a priority, because if you are sick, you're going to die. So you would drive, through the countryside or and you would often see men carrying, or women carrying a sick family member or a sick friend on these homemade poles and grass to the nearest clinic. The clinic care, the local clinic care, the health departments, public clinics are understaffed. They may have a nurse. They may have a nurse. The doctors that get to go to university have no desire to stay in Ethiopia because they don't get paid. The public hospitals cannot afford their salaries. So the healthcare system is very, very poor and weak. And we cannot rely on that to give us a reality, a real, thorough explanation or statement. They do whatever they can. And when we become aware of a medical problem, we research every possibility, but we rely on mission hospitals, which provide the best care.
We had a small infant who was transferred from the orphanage to Addis and was in dire straits. He needed a formula that was only available in the government hospital. And so he was admitted to that hospital. The family was just overwhelmed when they arrived to get him because the nannies were taking turns sleeping on the floor. He was in a room with 5 other very sick children. There were family members that were cooking on the stairways of the hospital in order to take care of their own families because there were no nurses to care for them in the hospital. There was no running water. And this was in Addis, the capital of the country. So it's just very hard for our American minds to grasp what day-to-day reality is and the fine line that you live on between life and death with these children. The survival that goes on.
You're right. So that describes the reality of a first world city, but then when you go south, where less and less medical care is provided. My husband is the only eye doctor that takes care of 3 million people.
Right.
So they are only now training people, local Ethiopians, to become aware of this. So there's another organization that we came to know about 3 months ago that have just moved into Awassa that is starting to take care of eye care in the area. And we rejoice about that because eye care is the biggest problem. The biggest concentrated problem of Africa eye care is concentrated in Ethiopia. And that's due to a lack of hygiene, it's environmental, and it is a lack of medical interest, medical care.